Hello everyone. Today we're going to discuss ankle fractures. Ankle fractures are some of the most common injuries of the lower extremity. The ankle can be fractured typically in 1, 2, or 3 spots. These spots are called malleoli. This is an ankle model, and one of the bones that can fracture, and it's actually the one that gets most commonly fractured, is called the fibula, and it's the outside bone of the ankle. The other bone that can get fractured is called the medial malleolus. And lastly, the third part that can be fractured is the posterior aspect of the tibia bone, called posterior malleolus. Now, these fractures can happen after a simple sprain, unfortunately, or can happen after a more high energy trauma. Not all ankle fractures need surgery. Some ankle fractures, known as stable ankle fractures, and the stability of the ankle fracture can be assessed by the orthopedic surgeon on specific types of x-rays and on clinical examination, can be treated non-operatively in a cast or in a removable boot. And in some cases, patients can actually be allowed to walk on that foot immediately. Patients will typically stay in a boot for about 6 weeks, and at that point they can start transitioning into a more comfortable shoe with or without an ankle brace, mostly for comfort. And physical therapy also starts at about 2 to 6 weeks after the injury to regain the function of the ankle. Those who are less fortunate and have what's called an unstable ankle fracture may need surgery to realign the ankle bones and maintaining the fracture alignment with some hardware. Most often the hardware consists of plates and screws. After surgery, the postoperative recovery can be a little different depending on the surgeon. For my patients, for the vast majority, I allow weight bearing immediately after surgery in a special type of fracture boot. And that boot has to be maintained for about 6 weeks. I usually encourage patients to start early ankle range of motion as soon as possible and start physical therapy anywhere between 2 and 6 weeks after surgery. There are obviously some complications that can be associated with surgery, and these range from superficial skin infections that most of the times can be easily treated with local or oral antibiotics, some prolonged wound healing issues, so having the wound take a longer time to heal even if it's not infected. Sometimes the bones may not heal. This is called a non-union, and sometimes these conditions need further surgical treatment. Other times you can get what's called a malunion, where the bones heal but in a crooked position, and that can lead to other short, medium, and long-term problems with the ankle. No matter what kind of ankle injury you have had, when you do fracture your ankle, you are automatically at an increased risk of developing ankle arthritis, which means you start losing the cartilage inside the ankle joint. The cartilage is a thin, smooth padding that lines the ankle bones and allows them to glide over one another without pain. When you start losing this cartilage, you get the so-called bone-on-bone arthritis, which is very painful and can be addressed with an ankle fusion or an ankle replacement. It's very important after surgery to have realistic expectations. After an ankle fracture, even though you will likely return to a very good functional status, the ankle is never going to feel exactly how it was before, and it's never going to have the same range of motion as the other ankle. This doesn't mean that your life is over. It doesn't mean that you will walk with a limp. Most of the times these changes do not really affect people on a day-to-day basis. Make sure that if you do fracture your ankle, you see an orthopedic surgeon for evaluation. He or she will be able to discuss what your options are based on the pattern of your fracture and explain what potential complications you're at risk for and the types of surgical treatments that you may be a candidate for. Regardless of the type of surgical treatment recommended, I always perform an ankle arthroscopy prior to fixing the ankle. An ankle arthroscopy consists of making two very small skin incisions at the front of the ankle and inserting a little camera in the ankle joint to remove any debris that may have gotten into the ankle following the ankle fracture. And in my experience, patients seem to do better when you do clean the ankle out and fix the bones at the same time compared to fixing the bones alone without looking inside the ankle. Again, this is something that you can discuss with your orthopedic surgeon for further guidance.